About evaluation of CBR training and paraprofessionals and non-professionals. After I take this session with you, you will be in a position to understand what CBR is, understand how the CBR personnel are selected and trained, identify the use of employing paraprofessionals and non-professionals, and also evaluate the importance of CBR personnel. First and foremost, what is CBR? CBR is the short form of community-based rehabilitation. Let me give you an introduction now. Community-based rehabilitation or CBR is a way of aiding the physically or mentally disabled individuals by empowering them as well as their families to work for a better life. For this purpose, community volunteers and assistants are trained to provide rehabilitative services to the unfortunate and in the process help them to overcome this misfortune. Community-based rehabilitation refers to the means of improving the lives of disabled people by providing them with equal opportunities and ensuring that they feel socially included and accepted. It was initiated by the World Health Organization (WHO) in the mid-1970s due to the scarcity of resources in developing of low-income countries. It provides the physically disabled with adequate health services through the efforts of the disabled people and their families. Vocational, educational, social along with appropriate health services are rendered. In its paper, World Programme of Action Concerning Disabled People, United Nations gave CBR international recognition. Let me discuss with you the CBR guidelines. The CBR guidelines provide a basis for the managers to ensure effective rehabilitation services for the disabled. They provide guidelines on how to develop and strengthen CBR programs. They promote CBR as a strategy for community-based development involving people with disabilities. They also support stakeholders to meet the basic needs and enhance the quality of life of people with disabilities and their families. The guidelines also encourage the empowerment of people with disabilities and their families. Let me tell you about the CBR workers or the CBR personnel as they are called. Community-based participation and rehabilitation work is undertaken by individuals who are in direct contact with the community and their families. They may be workers rendering the services, they may be social workers who supervise these workers, or they could be the trained professionals. CBR personnel act as representatives of the disabled in front of the health service personnel and provide continued care on behalf of these professionals. Unlike in the institutionalized care, CBR helps in reaching the people who need guidance and health services. Since the personnel mainly involve community volunteers and family members, they need to be trained. Due to the lack of professionals, the non-professionals are trained by sharing the skills needed for providing rehabilitation services. The workers may be segregated into non-professionals and paraprofessionals. Let me tell you about the paraprofessionals and the non-professionals first. Paraprofessionals are occupational workers who do not have the license to work as professionals but are trained to assist them. A non-professional is a person who is not trained to be part of the profession, but they are an important part of the mental health program. What is the importance of these paraprofessionals and non-professionals? Paraprofessionals and non-professionals simply increase the number of workers providing rehabilitation services. It's based on a simple concept, which is more the number of volunteers, easier it is to provide adequate mental health services. They provide various dimensions to these services by bringing in their individualistic qualities and bridging the gap between the communities and mental health professionals. They act as facilitators of mental health provision by putting in their already acquired skills. Through training, they contribute to the effective service provision. For example, parents who have children suffering from substance abuse are trained to deal with them. They are in direct contact with their children and can hence be effective in helping them. In fact, I feel they can be very effective because the direct contact with the children and in the 24/7 care can be most beneficial. Enhancement of the worker himself in the process of training is a part and parcel of the training program. He or she learns the skills to deal with the community problems. This makes the worker grow as a person. There are groups which are run by people who have suffered from a problem before and are now helping others to deal with these problems. Reisman in 1965 has called this the helper therapy principle. There may be a chance of getting employed as a professional through training and practice. For example, interns working at the hospitals are getting acquainted with the skills required for treating mentally or physically ill people. Let me tell you a little about the non-professional programs. There are student volunteers in mental hospitals. This involves college students working for psychiatric hospitals who provide direct and adequate care to the patients. They are mainly involved in the clerical work and are not in direct contact with the patients. Women as counselors. For mature women, this may act as an alternative career option in which they may provide inexpensive guidance to those in need of help. College students as therapists for boys. Instead of a clinical setup, boys who are dysfunctional are accompanied by college students who involve with them through conversations and other activities. Moving on to personnel training. The CBR workers are usually servicemen who need meaning and enthusiasm in their lives and want to work for the betterment of their communities. They are selected on the basis of psychological tests and interviews, and those acquiring qualities like sensitivity to social issues, or they have social skills and they are stable-minded. These qualities are utmost essential, and the people with these qualities of sensitivity and stable-mindedness are the ones who are selected. Zaks and Coven in 1967 selected housewives for their school project who had warmth and were comfortable in handling children. Goodman in 1972 provided a procedure, Group Assessment of Interpersonal Traits, or it was known as GATE, G-A-I-T, in which 7 to 8 applicants observe and rate each other. There is a disclosure who mentions an interpersonal concern, and there is an understander who listens. Then the disclosure statement is reread to assess whether the understander and the disclosure are on the same page or not. Now this is repeated until all the applicants have taken up the role of a disclosure and an understander at least once. So, the selected personnel are chosen mainly on the basis of their personality traits. For the purpose of training, not only the social skills are improved, but Counseling skills are also worked upon. Through group training, readings and practice, the non-professionals and paraprofessionals are trained to work for CBR. Now there have to be certain drawbacks of using non-professionals and paraprofessionals. Let me highlight those. Number one, he or she is not equipped with the required skills of rehabilitative services. They want quick changes which may not happen. Number two, they may be trained but they are still not professionals and hence may not get well-paid jobs due to lack of employment opportunities. Number three, the excitement may lead to impulsive behaviors and he or she may not understand the importance of detachment. These positive qualities may sometimes backfire. Sometimes the training may not empower the individual to compete against people who have gone through intensive training in the same field. They may not have secure career. Looking at the better side or the positive side is the contributions of paraprofessionals and non-professionals. They may take up various mini tasks and relieve the professionals from these small tasks. They accompany the disabled individuals through the stages of recovery. They may work like a professional but not without supervision. Let me do an evaluation of CBR. The outlines of evaluation of CBR are number one. First, you need to understand what is evaluation of CBR. We all know that evaluation word means assessment. Now, a working definition of evaluation of CBR refers to a standard to make objective judgments on the activities and outcomes of CBR program and the rehabilitation efficacy of people with disabilities in line with the goals, strategy, action plan, implementation of CBR program and the rehabilitation training scheme of the consumer. Generally speaking, there are three types of evaluation: goal evaluation, process evaluation and outcome evaluation. Relevance, effectiveness, efficiency, sustainability and impact are the core factors that should be considered in the evaluation of CBR. Moving on to its relevance. Does the program meet the needs and offer comprehensive rehabilitation services to people with disabilities and their families, or is it relevant to the program goals? Effectiveness. Does the program achieve its objectives both in terms of quality and quantity? And does it make satisfactory result in service coverage and the rehabilitation efficacy of people with disabilities? The next is efficiency. Does the program make the maximum outcome with minimum income? And does it use the resources in the most efficient manner? Next point is sustainability. Can the program continue once the external assistance is withdrawn? And next is impact. What effect has the program had on the social settings, economic development, rehabilitation technique and institution, etc.? What is the need to evaluate a CBR program? The needs are: number one, to assess the pertinence, implementation process, effectiveness and efficiency in accordance with the action plan of the CBR program. Number two, find out the changes happened in community development, attitude and sense to disability and rehabilitation, etc. Number three, judge whether the CBR service provided is effective, feasible, economical and also practical. Number four, assess the cooperation between the sectors of the community with implementation of CBR program, the approval, acceptance and participation of the community leaders professionals, disabled people and their family members. Identify whether the disabled people have achieved the rehabilitation goals. Nextly, examine and explore the contents, methods, process of evaluation in CBR programs. Followed by systematically collect, analysis and interpret information about the activities and outcomes of CBR programs in order to provide scientific basis for community leaders and the person concerned. In other words, the evaluation is a process of learning experience, drawing a lesson, revising plan and improving the ongoing program. A course of changing the evaluation management from traditional and experimental way to the modern and scientific way, as well as a good chance of remobilization and re-guidance. How does one evaluate the CBR program? For achieving the evaluation purpose that I have talked to you earlier, it is necessary to follow the principles of evaluation and take appropriate evaluation measures. Now these measures are: number 1, self-evaluation. The evaluators are said to be those who are inside the program or know the program very well. For example, program administrators, executors, target people, service consumers, etc. They are familiar with the program and can make contribution to the evaluation activities. Number 2, mutual evaluation. The evaluation is made between or among 2 or more CBR programs. The evaluators come from outside their own community. They can exchange experiences, draw on each other's advantages and avoid disadvantages. Higher authorities evaluation. The evaluation made by superior level departments that are in charge of the program. Therefore, the programs can get understanding, support and suggestion from their higher authorities directly. The next is external evaluation. The evaluation is carried out by the organizations and persons from outside the country or the community. Outsiders can take a fresh look at the program and will not be personally involved. So, the evaluation may be more objective. Each type of evaluation has its own strengths and limitations. However, they should all be guided by the following principles. Number 1, they should be based on facts. Number 2, they should be comprehensive. Number 3, they should include both qualitative and quantitative aspects. And number 4, they should include archival data and first-hand field findings. Now, when should the evaluation be done is also very important. As you all know that the development of a CBR is an ongoing process. For reaching the goals of a CBR program, there is a need for implementation to be in phases. Therefore, each phase's evaluation not only has to identify the CBR program for the particular phase, but also improve the program's work for the next phase and draw on the experiences and lessons for achieving the final goals of the CBR program. There are many factors relating to the realization of rehabilitation goals for the disabled people. The key factors are not the types and degrees of disabilities, but the attitude towards disabled people when the rehabilitation activities start. What kind of rehabilitation measures are used and social factors, etc. For example, a person with visual impairment can reach a higher level rehabilitation goal, but a person with a better eyesight may only reach a low level rehabilitation goal. Similarly, there is a need for achieving the best rehabilitation goal in each phase. Both evaluation for CBR programs and individual consumer of CBR services should be an ongoing activity. Generally, evaluation should be built into the CBR program at regular intervals. For instance, it could be a monthly evaluation, or it could be evaluation in stages like 3 months, half a year, 1 year. That depends upon the program development. It could also be a mid-time evaluation. It is essential to evaluate CBR program during the mid-time period. It can find out the experience and problem in order to decide what and how we should do. The evaluation could also be eventual evaluation. Evaluation should be made at the end of the program, which is most important. It should be detailed and overall of the evaluation activities takes place. Evaluation has to be follow-up evaluation as well. Some outcomes of findings such as disability rate, attitude change, impact, sustainability, substantiality can also be shown after a longer time. So it is necessary to conduct evaluation at a specified future date. What exactly does the evaluation process consist of? Number 1, it consists of making a detailed evaluation plan. Number 2, collecting materials and conducting investigation. 3, analysis of results. 4, making the evaluation report and giving suggestions. And 5th, feedback of results and putting them into practice. Let me summarize what I have taught you. Community-based rehabilitation, or CBR as it is called, is a strategy for enhancing the quality of life of disabled people by improving service delivery, by providing more equitable opportunities, and by promoting and protecting their human rights. It calls for the full and coordinated involvement of all levels of society, community, intermediate and national level. It seeks the integration of all the interventions of all relevant sectors, which are educational, it could be health, legislative, social and vocational, and aims at the full representation and empowerment of disabled people. It also aims at promoting such interventions in the general system of the society, as well as adaptations of the physical and psychological environments, which will facilitate the social integration and the self-actualization of disabled people. Its goal is to bring about a change, to develop a system capable of teaching all disabled people in need, and to educate and involve governments as well as the public. CBR should be sustained in each country by using a level of resources that is realistic and maintainable. It can be said that CBR is a method of bridging the gap between the more fortunate and the less fortunate members of the community. It involves training of volunteers and family members so that they can aid the physically or the mentally disabled people. At the community level, CBR is seen as a component of an integrated community development program. It should be based on decisions taken by its members. It will rely as much as possible on the mobilization of local resources. The family of the disabled person is the most important resource. Its skills and knowledge should be promoted by adequate training, supervision, using of technology closely related to local experience. The community should support the basic necessities of life and help the families who carry out rehabilitation at home. It should further open up all local opportunities for education, functional and vocational training, jobs, etc. The community needs to protect its disabled members to ensure that they are not deprived of their human rights. Disabled community members and their families should be involved in all discussions and decisions regarding services and opportunities provided for them. After all, they are the first party. The community will need to select one or more of its members to undergo training in order to implement the program. A community structure or a committee should be set up to provide the local management. It ensures that the low income countries are provided with effective health services in order to empower them. Therefore, CBR is as effective as institutionalized care and has the added advantage of training the community members to reach the weaker sections of the community.